नमस्कार। हेल्थ फॉर ऑल के आज के एपिसोड में आपका स्वागत है। मौसम बहुत गर्म है, ऐसे में सेहत की ठंडी डोज की बहुत जरूरत है। आज की कड़ी में हम बात करेंगे हाइपरटेंशन या हाई ब्लड प्रेशर पर। ये एक ऐसी बीमारी है जो घर घर मौजूद है। लोग इसे बहुत गंभीरता से नहीं लेते और सोचते हैं कि एक गोली काफी है इसे नियंत्रण में रखने के लिए, लेकिन वे भूल जाते हैं कि हाइपरटेंशन हार्ट अटैक और स्ट्रोक का सबसे बड़ा कारण है।
Preventive care is the key to healthy future. How can technology help? Maybe cloud-based solutions, integration of point-of-care devices with analytical tools for better prediction. We would like to hear from you on these important aspects. The reason why I have chosen preventive care as the first question is prevention is better than cure. We have been hearing this from our childhood. So that is a very, very key important aspect, and technology would play an important role.
Prevention is better than cure. But in what we have seen, prevention can come with education and awareness. I think what is lacking specifically in Indian environment, that people are not aware of what really is health and wellness. Because health is always been correlated with something called clinical care, clinical assistance. And health and wellness actually starts much before somebody thinks about being sick, or somebody thinks about that I need to seek clinical advice for that. And technology in that particular manner is very helpful. Already people are getting aware of the value of using small things like wearable devices. There are a lot of people starting to use blood pressure monitors at home. A lot of people are already having technologies which are providing to them in the senior care, the assisted living facilities. So technology has already intervened into where we call where the people are, instead of where the health systems are. Even today, the labs at home, the e-commerce, similar to e-commerce, the e-health initiatives have evolved to a very large level thanks to COVID. Largely that the adoption scaled up to that level, the awareness that the health is very important and people need to avail that health to fight against these unfortunate situations which arise and there's no control at that time. And the main thing which has come up, or the spread happened, is telemedicine, telehealth. In India, national health digital infrastructure also came at the right time, where now government is taking part into saying, let us take one step forward and provide that education and awareness to people so they can think about health insurance. They can think about they need to be healthy to take care of themselves, right? Health is part of that. It's part of daily living. It's as important as anything else. Like we should not avoid that prevention or the health, because then when it becomes chronic, it is too late for us. The only thing which is missing right now is the enablement. As you mentioned, 73% of Indian population is still rural. And even in urban areas, most of our healthcare is delivered by small clinics. Small clinics, even though there is a spread of digital technology out there, small clinics have not adopted that, because even having the infrastructure given by government or the mandates given by government, there is no facilitation reached out to the roots of Indian healthcare infrastructure. So three things which technology, even though it is there, needs to be adopted. One, education and awareness for every individual. Then health and wellness is not about clinical care. Health and wellness starts much before that. We need to understand that our infrastructure is not about big hospitals. Every single small clinic, to an individual doctor, to even the wellness provider like our counselors, our simple healthcare providers in general, even the yoga and the diet, the nutrition counselor, they belong to the same ecosystem, including paramedics. So they all should be enabled with digital technology to become part of the preventive ecosystem.
How important are point-of-care devices, and would like to understand how effectively are they being used currently, both in the government and private sector?
Actually, technology is what? Technology doesn't mean only electronics. Technology is an efficient way of how human processes are used, right? In a certain sense, at a particular time in past, when maths was invented, it was technology because it made counting and all such things easy. Or say inventing a wheel was technology because it helped people move faster from one place to another. So unfortunately, technology is only referred to as a very sophisticated electronic device, but not necessary it should be. Preventive care is very important because especially for a country like India, no matter how many doctors you put or how many nurses you put, it will never be enough. I have worked in the government sector since so long earlier. I saw that the OPDs and even now they are all so crowded because even for small minor ailments like fever or cough or cold, those people visit tertiary care centers or they visit brick and mortar centers. Where I personally feel if there is an efficient way to handle that, these people should never go to a hospital. They should never go to a doctor in the first place. They should somehow be diagnosed for their common cold, cough, fever problems at home, where after their initial diagnosis, if that thing is not subsiding through a certain level, only then they should be referred to a physical brick and mortar place. And this I have observed in a country like Israel when I visited there too. And I keep on visiting. I have kept on visiting various countries just to understand how different healthcare processes are there in different countries and how efficiently they manage it. For example, in Israel, they use this app for first level of care. That means if you have any problem, you do a telemedical consultation. If you have a dermatology, skin problem, you just show that on a photograph on an app, and then most of it gets resolved on the app itself. The pharmacy prescriptions are done on the app, and so only if that thing doesn't solve your problem that you go to a hospital, and that is where your doctors and nurses and everybody physically is optimized. And India has been using something like that since a long time. Not when I said technology is not just electronics. For example, our ASHA workers, our ANMs, our ASHA workers, for example, got recognized globally now through the WHO recently. They won the award. That they are the ones who actually play a major role in preventing all these problems. So they go to the houses, they check if somebody has fever, etc. They prescribe these medicines. Anganwadi workers prescribe these medicines, say malaria medicine or whatever, on the field, so that these people don't come to the hospital.
The first report on pediatric hypertension by the National Heart, Lung and Blood Institute, published way back in 1977, declared that detection and management of hypertension in children and the precursors of hypertension in adults are the next major frontiers. The report also recommended annual BP measurement in all children above 3 years. Unfortunately, so many years later, the diagnosis of hypertension is missed in majority of the cases, and familiarity with pediatric hypertension among clinicians seems to be very poor. What are your comments?
Yeah, I agree to that. I think that instead of treating the problem, I think we should first address the root cause. The root cause of the problem is, especially in pediatric hypertension, majorly, like if there is some sort of disorder or disease, we can obviously check. That will be identified much earlier because with the patients will do the test and everything. But majority of the pediatric hypertension is again related to the lifestyle disorders, the food they are eating, the availability of junk food, the lack of sports and exercise. There is the very sedentary lifestyle, the availability of Wi-Fi 24 hours, the sitting of the children in front of the TV, computers, each one. Now, earlier we had one computer. There was a time when we had one computer in family. Now, everybody has a computer of their own. Father, mother, child, grandfather, everybody has a computer of their own. And everybody is busy with their computers or phones, the smartphones. So that is something which we need to address before even moving on to something else. So this we should go back to our roots. We should start the physical activity. We should decrease the junk food. We should increase the intake of our Indian food. It is a very well-balanced diet. If we take it properly, it's a well-balanced diet. There is a combination of spices There is a combination of even pickle and all. If you take it in a very small amount, it helps you increase the metabolism.
हाइपरटेंशन के कारण और लक्षण क्या हैं? बहुत से लोग ऐसे हैं जिनको हाइपरटेंशन है लेकिन उनको ही नहीं पता.
सो हाइपरटेंशन, जैसे आपने कहा है कि कुछ लोगों को हाइपरटेंशन है और उनको पता नहीं, एंड दैट इज अ वेरी इंपॉर्टेंट एंड अ वेरी कॉमन थिंग जो हम देखते हैं, क्योंकि हाइपरटेंशन का 90% ऑफ द पेशेंट्स में कोई सिम्टम नहीं होता है. आप आएंगे हॉस्पिटल में या घर पे अपने बीपी मशीन से चेक करेंगे तभी डिटेक्ट होता है. ओनली 5% पेशेंट्स में कुछ उनको सिम्टम्स महसूस होते हैं. इसीलिए रूटीन चेकअप बहुत इम्पोर्टेंट हो जाता है कि हम अपना रेगुलरली हर साल में एक बार कम से कम बीपी चेक करें.
There is an emerging trend to empower patients to support hypertension screening and diagnosis, and several studies have shown the benefit of telemonitoring, particularly when coupled with co-intervention in improving the management of hypertension. What is the scenario in India?
Telemedicine has taken off, and it's for the good, because what telemedicine actually does is, if you practice it in the right way, it's a very, very powerful tool to reach out to communities that do not have ready access to healthcare. I mean, I'll give you a simple example. I mean, being a cardiologist, there are many patients who have prosthetic valves or an atrial fibrillation with rheumatic heart disease whom we put on warfarin. And we ask them to just get a simple PTINR test done and go and show their local physician, so they don't need to come down to the city because they stay 200-300 kilometers away. And you'll be surprised at the percentage of patients who say that, you know, they don't have access to a physician. I mean, they don't have access to a physician or even an MBBS graduate within 10 kilometers of their of where they are staying. I mean, some people even up to 100 kilometers. They say we have to go to a different town altogether to get access to health care. So telemedicine coming in, if practiced in the right way, will help a lot of patients, will help a lot of us to reach out to patients. The second thing is coming to screening. Yes, I think everyone has to probably today's day and age have a glucometer and have a BP apparatus in your house. It's not only for the elderly population, but even for the youngsters, maybe anybody who's crossed 30. Probably once a month you should sit on a day when you're relaxed, check your blood pressure at rest and see how it is. You'll be surprised because blood pressure, as one of our colleagues was just saying, 90% of the time is asymptomatic. You don't know you have blood pressure until you know it's gone out of control and you start having symptoms. Headaches, neck pains, early morning headaches, pain at the back of your head, giddiness unexplained, giddiness when you get up from a sitting position happening more than once, sudden changes in your lifestyle, having more of salt. All these things should alert you that probably you need to get your pressure checked.
क्या क्रोनिक हाइपरटेंशन प्रेगनेंसी में और खतरनाक स्थिति में पहुंच जाती है?
कई बार ऐसा होता है कि पेशेंट्स को पता नहीं चलता कि मैं हाइपरटेंसिव हूँ. इसका एक स्पेसिफिक रीजन है. The blood pressure is a very vital part of normal functioning of human body. अगर ब्लड प्रेशर बॉडी उसको कई लेवल पे कंपनसेट करने की कोशिश करती है, एंड ऑर्गन के लेवल पे, हार्ट के लेवल पे, ब्रेन के लेवल पे. सो धीरे धीरे जैसे जैसे ब्लड प्रेशर बढ़ता है वैसे वैसे बॉडी के कंपनसेटरी मैकेनिज्म्स एक्शन में आते हैं. तो वो कंपनसेटरी मैकेनिज्म उसको कोशिश ये करते हैं कि ब्लड सप्लाई नॉर्मल बनी रहे, और बॉडी इंसान को रियलाइज ही नहीं होता कि मैं धीरे 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 हाइपरटेंशन की तरफ जा रहा हूँ. दैट्स व्हाई दे आर नॉट एबल टू फील द सडन चेंजेस बिकॉज सडन सिम्टम्स आर नॉट देयर. सो आपने कहा क्रोनिक हाइपरटेंशन ज्यादा खतरनाक होता है. अगर क्रोनिक हाइपरटेंशन आपका मेडिसिन से कंट्रोल है तो यूजुअली एक तरीके का सिस्टम सेट होता है, और ऐसे पेशेंट्स को प्रेगनेंसी में भी मैनेज करना आसान होता है. ज़्यादा खतरा हमें प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन या जेस्टेशनल हाइपरटेंशन से होता है, जिसमें सडनली बीपी राइज होता है और वो उसमें प्लासेंटल फंक्शंस बहुत ज़्यादा अफेक्ट हो जाते हैं. बेबी को प्रॉपर ब्लड सप्लाई नहीं मिल पाता और बेबी की ग्रोथ प्रॉपर नहीं हो पाती. अगर हम प्रेगनेंसी आउटकम के टर्म्स में समझें तो क्रोनिक हाइपरटेंशन को फिर भी मैनेज करना आसान है. जेस्टेशनल इंड्यूस्ड हाइपरटेंशन या प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन को मैनेज करना डिफिकल्ट होता है. क्योंकि कुछ भी करने के बाद ये कंट्रोल नहीं हो पाता. ब्लड सप्लाई कम होती चली जाती है, बेबी की ग्रोथ कम हो जाती है, इंट्रायूट्राइन ग्रोथ रिस्ट्रिक्शन सेट इन हो जाता है, बेबी को कई बार हमें प्रीटर्म बेबी को बाहर निकालना पड़ता है।